So oftentimes we get asked a question, is this muscle pain or is it nerve pain? And a lot of times patients confuse muscle pain, nerve pain. So this at times can be hard because it can be both. Muscle pain is in the distribution of a muscle, obviously. And so we know where the muscle bellies are. And so pain that doesn't radiate from one area to another is usually consistent with a muscle pain. Now, muscles can spasm and you can have pain up and down the muscle belly, but the difference between a muscle pain and a nerve pain is nerve pain shoots in the distribution of the nerve, and it usually goes in or almost in the entirety of the distribution of that nerve. So for example, we know where the L5 nerve goes. We know where the pain is going to be in the distribution of that L5 nerve based on the anatomy of the L5 nerve. So we can tell patients, depending on the type of pain they're having, is this nerve pain or is this muscular pain? And we know that by differentiating, is it in a muscle belly or is it in the distribution of the known course of the L5 nerve? Typically, muscle pain can come in different forms. You can have a strain or a sprain, and that can give you some spasm of the muscle. It can give you some tightness in the muscle. Versus nerve pain has at times a very sharp, stabbing pain that radiates from one place to another. It can lead to numbness, tingling. It can lead to burning or what we call dysesthesias in the nerve. It can even lead to deficits where the muscle itself doesn't work. But we try to differentiate it, and at times it can be difficult because patients can have overlapping issues. They can have a muscular strain or sprain, but they can also have a nerve issue where they're having what we call a radiculopathy or sciatic at the same time. And so it does take a little bit of questioning and a physical exam to really parse out the difference between these two.